Hello everyone, welcome to sqadia.com. And now we are on the clinical features of rheumatoid arthritis. We'll be going through the history and symptoms when the patient presents to us, then what are the on patient's examination findings, and then how will we be making our diagnosis and what investigations and radiological x-rays we need to do to get to the diagnosis. Coming to the symptoms, onset is usually insidious, symptoms emerging over a period of months at times. Early stages, there may be some degree of polysynovitis with soft tissue swelling and stiffness. There's generalized stiffness after a period of inactivity. Now, the morning stiffness is very important because usually patients, maybe the very early symptom is that patient complains of some degree of swelling in hand, some degree of stiffness, and there may be this stiffness very much marked, especially early in the morning. Early morning stiffness usually lasts longer than the 30 minutes. Now, what are the history? What is the patient? What when the patient really comes to your clinic tells you? The typical history involves a woman of 30, 40 years age. Usually, it's in some European countries, it's in the third and fourth decade. In America, it's usually in the fourth and fifth decade, which is common, but mostly it's the female. We complain of swelling and loss of mobility in the proximal joints of the finger. The most important is the small fingers, the small joints of the hand, especially the metacarpophalangeal joint, proximal and distal interphalangeal joints. There was a previous history of muscle pain, tiredness, loss of weight, and general lack of well-being. Although this is a very history is usually in wage history at times, but once if the patient complains of morning stiffness and there is decreased range of motion on the hand and swelling, one must suspect rheumatoid arthritis, especially if she is a female. Now, this is a diagram which is showing classical presentation of hand in rheumatoid arthritis. Now, this is in some form of advanced stages. It's not in early stages. You can appreciate rheumatoid nodule, which is present on the extensor surface of the wrist. There is some degree of swelling as well in the knuckle area, and then deformity, which of on the right hand there's some degree less degree of deformity, but on the left you can appreciate some degree of more ulnar deviation as well as and classical. On this side, if you see, this is actually a more of an advanced case. The rheumatoid nodules may be very small, but if you see there is a cross ulnar deviation, there is some mallet finger as well present over here, and swan-like deformity is positive as well, and there is volar and radial subluxation of the wrist joint. Now, this is also showing the advanced stages of a disease. In the late stages, there is joint deformity, especially in the hands. This acute pain of synovitis is replaced by more constant ache of progressive joint destruction. And if you see it over here, again, this is the picture which is showing the bottomless deformity in the middle finger. The ring, little, and the index finger are showing a swan-like deformity of the mallet finger. A typical rheumatoid hand deformity includes rheumatoid hand deformity includes ulnar deviation of the finger, this is the radial side, this is the ulnar side, the fingers are deviated towards this. The radial and volar displacement, that is the hand is going downwards volarly, radially, and this way, that the fingers are going away from the radius while the wrist is volarly and radially displaced. Now, this is also showing what happens the finger deformities of the patients in rheumatoid arthritis. If you look closely, there are physical signs, maybe very much minimal, symmetrically distributed swelling and tenderness, especially of the small joints of the hand, that is the metacarpophalangeal joint, proximal interphalangeal, and distal interphalangeal joint. If you see it over here, now this is the bottom swan-like deformity of the distal interphalangeal joint, and this is the bottomless deformity of the proximal interphalangeal joint, but the deformity may be present over here as well as over the wrist joint as well. Tenosynovitis in extensor compartment of the wrist and flexor sheath of the finger may be present, and as a result, extension and flexion of this joint may be highly painful. Now, this is also showing the same thing, that what happens when you examine a patient with the rheumatoid arthritis. Diagnosis by feeling thickening, tenderness, and crepitation of the back of the wrist or the palm while passively moving fingers. Why? Because the synovium is not thick, the tendons are thick. As a result, when they glide over each other, they may be rubbing each other, and as a result, this produces tenderness as well as crepitation on the passive flexion and extension of the fingers. Now, what happens? What are the symptoms if rheumatoid arthritis in the lower limb, and if there are symptoms in the spine as well? Usually, if the knee joints and large joints are involved, which may include the hip and the knee, there's local warmth. There is synovial hypertrophy leading to increased swelling. Then there is intra-articular effusion, which also contributes to swelling around the knee. Then there are valgus knee form, that is the knees actually have become more of a valgus knee, that is called as knock knee deformity, which may develop. Then the feet may also go into valgus. Why? Because the joint destruction is such that actually the axis of the foot is changed. Then there may be due to destruction of metatarsophalangeal joint and interphalangeal joints, there may be clottos. Then joint movements get restricted and highly painful. And lastly, in the spine, there may be pain and stiffness of the cervical spine. As initially there may be pain and stiffness, which is further enhanced by C1, C2 instability, that is called as atlantoaxial instability in rheumatoid arthritis. Now, if you see it over here, this is the X-ray of the foot, of the left foot, which is actually showing the gross changes of the rheumatoid arthritis. It's, if you appreciate the metacarpophalangeal joints, and there may be subluxation and dislocation of certain metatarsophalangeal joints. The interphalangeal joints may also be affected as well. Now on the right side, this is post-surgical radiograph. They have done the arthrodesis of metatarsophalangeal joint as well as the tarsometatarsal joints as well. And there may be some degree of resection being done at the other metatarsophalangeal joints of the other fingers. As we know that it's kind of a disease which not only affects joints, but it affects all other areas as well, from lungs to eyes to heart, from to intestine to kidneys and to bone. So these appearance of nodules usually are some small subcutaneous lumps, rubbery at back to the elbows. The patient may present with pain, swelling, deformity of the hand, and there may be rheumatoid nodule as well, which may be present as well on the extensor surface of the forearm and the hand. In tendon, there may be triggering and rupture. Once the tendon becomes thick, it may result in the first triggering, or once the tendon becomes so weak that it may result in a rupture. This may be, the patient may not be able to fully extend or flex his or her finger. In other viscera such as eyes, there is pathognomic of rheumatoid arthritis. For example, there is increased scleritis and keratoconjunctivitis in the patients with rheumatoid arthritis. Rheumatoid nodules are pathognomic of rheumatoid arthritis, but unfortunately they are only present in 25% of the patients. Other features of rheumatoid arthritis which are outside the joint, these include muscle wasting, lymphadenopathy, scleritis, nerve entrapment syndrome resulting in compression neuropathy, skin atrophy and ulceration, vasculitis, and peripheral sensory neuropathy. Why? Because of the loss of the synovium, the tissue swelling, and damage to the peripheral nerves as well. And lastly, it's rarely, although the pulmonary fibrosis, but once it develops, it's highly debilitating, and one of the most common cause of death in rheumatoid arthritis is either due to MI or it is due to pulmonary fibrosis. Now, these, once you know that a patient lady has come to you with these symptoms and you're suspecting RA, how would you investigate that patient whether he or she has rheumatoid arthritis or not? There are two ways to do it. The other one includes is the radiology, which the most common are the X-rays of the hand, especially or for the feet, depending upon kind of pathology. If she's complaining of hip pain and knee pain, then we need to get the X-ray of the knee and the hip. Or if there is spinal pain or neck pain, then we need to get the X-ray of the cervical spine as well. But now this on the right side, you can appreciate this lady probably as she is wearing bangles has I can appreciate the x-rays of both the hands. There is some degree of pulmonary deformity of the left thumb. There is increased metacarpophalangeal joint destruction of almost all the fingers of the right. Then there is interphalangeal joint is also involved, especially proximal interphalangeal joint, and this is resulting in pulmonary deformity over here. And there's destruction of distal interphalangeal joint as well, leading to mallet finger. What would the X-ray show? They would show some degree of synovitis, soft tissue swelling, periarticular osteoporosis, and in later stages they will show marginal bony erosions, narrowing of articular space, especially in the proximal joints of the hand and the feet. What lab investigations you can do in rheumatoid arthritis? The most common is CP. What would it show? It would be normocytic hypochromic anemia, because usually it would show some degree of chronic disease which is probably going on in the body. ESR and CRP in active phases concentration are usually raised. RF factor is positive in about 70 to 80% of the patient, but not in all. If you go for anti-cyclic peptide antibodies, then they are more specific for RA, and if they come out positive and patient has history of hand pain, especially morning stiffness and generalized pain and swelling of the hand, most likely he or she is having rheumatoid arthritis. Now they are showing the X-rays of rheumatoid arthritis. As you can appreciate, if you see it over here, first if you see the wrist joint, there's increased arthritis of the wrist on the right side. Then if you see this is the proximal interphalangeal joint, there's increased bony erosion and end stage arthritis of the interphalangeal joints. On the other hand, if this is somewhat spared, but if you see the distal interphalangeal joints, they are more involved on the left side rather than the right side. Thank you very much. Keep watching sqadia.com.